Hi there, Dr. Andrea Shanowski from Align Life of Peoria, located inside of the Metro Center. I'm here today to talk to moms, soon-to-be moms, expecting moms, a little bit more about abdominal pain that happens during pregnancy. A lot of women have questions and concerns when we're having pain in our abdomen because, let's face it, as we're pregnant, we always have the worst things on our mind. So I want to talk to you and give you a little information to help you feel more comfortable and also encourage you to ask questions about your doctor or ask questions from your chiropractor about how they can help you throughout your pregnancy. So first thing I want to do is give you a little bit of an anatomy lesson so we can understand a little bit more about what's happening as our body is changing. So I'm going to grab Junior here, and as you can see, Junior is a spine. We have basically the bones of our spine are lined up. We have discs in between that help supply shock absorption and also make sure there's plenty of room for our nerves to travel through. We have muscles that attach to that and ligaments as well that help to stabilize our uterus. So inside of your pelvis, and we can look through and see not much room in there, inside of our pelvis is where our uterus is located. So as baby grows and our uterus expands, that's attached by 3 different sets of ligaments. So 6 ligaments that hold our uterus in position. The first set of ligaments is called our round ligaments, and those attach from the front here of the uterus, and they go sideways and they attach to the front of the hip bone here. So we may feel any type of inguinal pain or pain kind of right here in the front of our abdomen, basically attaching from the inside of the pelvis area to the front of the uterus. So if your uterus is tipped forward or backward, or if we're growing and we're getting some stretching of that ligament, especially during first pregnancies and subsequent ones, we may have some sharp pain, even some pain as we're moving. Notice, oh, what was that? It felt like a kick, but it was a little bit worse. That may tell you that, hey, my round ligament is stretching. If we're noticing it consistently on one side, that may mean that your uterus is twisted, which means that we have some type of issue with possibly intrauterine constraint or even how the uterus is attached to the pelvis. And we'll talk a little bit more about that in a minute. But you've got that first set of ligaments from the inside here to the front of your uterus. You have another set from the back of the uterus, and that goes here and attaches on this orange piece, or the sacrum. So if we have any issues with the uterus twisting, we can get round ligament pain. A lot of times with that posterior ligament there that attaches on the sacrum, you may have back pain. And a lot of times women that are experiencing back pain or sciatic pain during their pregnancy may go to their doctors and even do sometimes ice, medication, things like that. But a lot of times there's some other solutions that naturally can help you throughout your pregnancy with chiropractic care to help not only relieve pain but also make sure the uterus is in perfect position, so then when the birth time and labor comes around, you have a very comfortable experience. The last set of ligaments is a very, very big ligament. It's called the broad ligament. It stretches from the front of the uterus all the way around, and it actually attaches on your low back. So again, if we're having uterus issues, we may have back pain coming from a uterine misposition. So a lot of times your medical provider may just be making sure that everything's good on the other end, making sure that your cervix and everything on the other end is working great, baby's growing, but they may not be looking for musculoskeletal issues. So if you're having any abdominal pain, that can be a sign that your uterus is mispositioned, twisted, or maybe the bones that it attaches to could be out of position. That could be causing pain and also making intrauterine constraints, so smaller spaces for baby to grow. Throughout your pregnancy, you may have some discomfort, some low back pain, some pain down into the leg. That's a sign you need to get it checked out. However, as we get closer to labor time, if baby's not flipping face down like he or she is supposed to, and we're having issues with baby flipping, that may be because the uterus is twisted and not allowing baby to flip downward. So if you have a breech baby right now and have been looking for some options, there's some really great stretches that can be done to help kind of loosen up and allow baby to flex down. But if you've been doing the stretches on spinning babies or even doing stretching that your medical doctor or OB has given you, that may not be enough. You may actually need to get a chiropractic adjustment to realign the bones, allow that uterus to get back in position, and give baby extra space to flip down so that we're ready for labor. So if you have any questions, you want to find out more about how I can help you, again, Dr. Andrea Shanowski from Align Life of Peoria in the Metro Center here in Peoria, you can give our office a call, 689-6200. You can also go on our website, which is chiropractorpeoria.org, and request an appointment that way. Hopefully we will see you soon and answer any questions that you have.